You've heard a lot of testimony from business owners and now healthcare providers.
And a lot from consumers as well.
And what's your opinion on the healthcare bill? Do you think you'll support it?
Yeah, I'm on the Health and Welfare Committee in the Senate, so we've been working on the bill since the beginning of the session. We've heard hours and hours of testimony, and we'll be changing the bill in response to a lot of the testimony we've heard. We're trying to incorporate the concerns that business have, and all of the constituencies that we've heard from. But ultimately, I'm confident that there'll be a bill that I'll support. Yeah.
Okay. Are there any amendments that you would are thinking of introducing, or that you would want?
Well, we made hundreds of I really think hundreds of changes already on the bill as a committee. I and Senator Polina are working on an amendment to change the duties of the board and compared to what the state government is doing, to make sure that the function of the board is really to make decisions based upon information that comes to it, and not necessarily participate in the development of the various plans that it's going to have to make a decision on. And I think that will strengthen public confidence in the board, and that its decision making is going to be totally transparent and in public.
Okay. Do you know if this board, are they going to be on this healthcare plan also, or do they have something separate?
What do you mean by that?
This plan that they're going to put together for everyone else, will they be part of that plan also?
Every Vermonter ultimately will be, every citizen of Vermont will have the access to health insurance at the end of the process, which is could be years away, 2017.
Okay.
So all you have to be in order to be eligible for Green Mountain Care is a citizen of Vermont.
Okay. Do you support supplemental policies and people buying these from private insurance companies?
Well, I think that depending on what the benefit package ultimately is, and we don't know that yet. Some of it depends on what the federal government is going to set out. Some of it will be designed ultimately by the board. There probably will be some folks who will want to supplement that with additional coverage, and nothing in this bill prohibits them from doing that.
Okay. Do you know if that's been factored into the cost containment estimates?
Everything is going to be factored into the financing plan and the cost containment.
Okay.
It's a plan that's going to be, there's going to be a design of what we want to have included in the benefit package. Some of it we have no choice. The federal government is going to say that, but this is all about cost and making things affordable.
Okay. All right. Well, thank you so much for your time.
Okay.